Representative Hart, what we've seen in reports before to date, we're seeing 2% fewer emergency room visits and about 25% fewer uncompensated emergency room visits with co-payments that are the same as we're talking about now. All we're doing is we're giving a window into how the rest of the payments are flowing for the individual. It may be intended for it to have an impact on the behavior of the patient and the consumption of those services. I think not covering non-emergency room visits is a pretty strong incentive not to use it.
But I'm not saying we're going emergency room for emergency. They're going for the primary care now because they cannot afford to pay the $20 copay because they have no money left on their phone. If that's what they're trying to do. If you're trying to educate them into a system that you're here, you're not educating them into that system. You're actually educating the system more than the emergency room for a care because we're out of money on our farm. Why would we put money in our farm when I go to the emergency room?
Well, we may respectfully just disagree. This is putting money on their card. It
But
doesn't incent them to do the behavior that I think.
And I think we're not educating our parents, or we're not educating this population to use this. We're educating our population to use emergency room again. I think we're going in a circle.
It's not what we're observing.
Representative Ford, I would say this in terms of what you're seeing, particularly with the healthcare institutions in the state. Just because you walk into the emergency room, they don't have to treat you. Let me give you an example.
They have to treat us. You have to be treated.
Yeah, you treat them. So what's happening now, different hospitals are doing it different ways. Some of the hospitals are requiring a phone call to the primary care physician or somebody linked into that place. Baptist Hospital here is triaging and moving people to an adult urgent care clinic
Right.
that they've opened up, an idea that we both love, and we're seeing the impact of it. So, from a health transformation standpoint, the policy of not paying for non-emergency use of the ER puts the onus back on the healthcare institution to figure out the best way to get the best care for that person and what he or she needs at that given point in time. And in some instances, it's calling up and making an appointment at a primary care with a primary care physician. But again, I understand your concern that what we've seen in other areas where this has been tried is that the result that you're concerned about hasn't been, that has not been the experience.
Well, and I go back to Robbie Brock's article just yesterday, and it said that St. Vincent's has increased their emergency room visits.
Yeah, they have. They actually, in Central Arkansas, they have. I would also, my follow-up question to Mr. Banco would have been, what are you doing in terms of triaging individuals when you walk into the facility? They have not been one of the institutions, and I see the Hospital Association in the back of the room. I have not seen them announce policy changes in terms of their triaging. The truth is, if those individuals are private option patients or now Medicaid, because Medicaid is now adopted has the same rule, that there may be particular exposure for St. Vincent in terms of what they're going to be required to cover, because if it's determined that it's not emergency, they're the ones that are exposed. So my response to Mr. Banco, who I think is a fine leader of his institution, is they may need to look at some of the innovative things that other hospitals are doing, where down the street you're seeing a significant drop in ER and at in the other direction as well.
Yeah. Well, I think the education, we're trying to educate this population, and we're fighting the education that we're doing because we have no, I don't say punishment, but consequence of not using the card. I think our education is going backwards. Thank you.
Maybe that's a reason of a positive discussion. Representative Burris, you're recognized for a question.